Once again, our distinguished guests, our esteemed members of the Pharmaceutical Society of Kenya, the National Executive Committee of the Pharmaceutical Society of Kenya, welcome to today's conference, the Pharma Supply Chain Conference. Welcome to the Pharma Supply Chain Conference, the second edition of the Pharma Supply Chain Conference, which is now virtual, and it's in partnership with various partners, that is Strasbourg Business School, in partnership with Cosmos, in partnership with Imperial Health Logistics. Karibuni sana to today's meeting. We're going to begin probably in the next 2 or 3 minutes, whereby I'll call upon the CEO to begin the meeting. Ladies and gentlemen, just to probably give a preface of why we are here today. The supply chain, the global supply chain during the COVID pandemic was greatly affected, and that was evident in terms of the drug supply chain was greatly affected. And out of that, we began a conversation last year on how best we are going to be able to improve our supply chain of drugs. And with that, we have been able to kickstart this conversation. We kickstarted the conversation last year. We are now having this conversation greatly. And this year, our theme is on financing health products and technology supply chain. How are we looking at the financing bit of the health products and the supply chain? How are we looking at the supply chain of supplying the health products? So apart from that, ladies and gentlemen, we are also trying to see, are we able to provide solutions in the country, tailor-made solutions, to see that we are able to get solutions to these supply chains. So, ladies and gentlemen, welcome to today's meeting. It is going to be not more of a sit and listen. It's going to be more of an interactive session. I will ask you probably to even type in on the chat box and let us know which part of the country you are joining us from. That way, we're going to be able to have a one-on-one discussion, and also let us know which are among the main problems that you're facing in the supply chain of drugs in the country currently. Without further much ado, ladies and gentlemen, let me first and foremost take this opportunity to recognize our guests from Strasbourg Business School, Karibuni sana, led by the team by Nelson. Karibuni sana and welcome. Apart from that, allow me to recognize the National Governing Council members who are here with us today, distinguished seniors of the Pharmaceutical Society of Kenya, respected honorable fellows of the Pharmaceutical Society of Kenya, and esteemed colleagues of the Pharmaceutical Society of Kenya. We begin now. I will now take over, and probably before that, I'll give a few ground rules. So I will be taking us through the opening ceremony and a few ground rules. Thank you for participating in this conference. Thank you very much. Thank you so very much for that. All participants I remain muted during the entire course of this session. Please ask questions via the Q&A tab at the bottom of your window. Questions shall be addressed by presenters on the Q&A tab. For PSK members, if not already done so, please subscribe on the PPB portal. The event is already on the portal so that you can get your points. 6 points will be awarded to paid up members. For KPA members, the attendance shall be shared with your officials for awarding of the CPD points. A point to note is that this session is being recorded, and it shall be shared later on to the Pharmaceutical Society of Kenya YouTube page. So, ladies and gentlemen, without further much ado, allow me to welcome the CEO for his welcoming remarks, the prayer, and the national anthem. Dr. Nyabero, are you here with us?
Yes, I am.
Karibu sana Daktari, take over on the welcoming remarks and hand it as you welcome the Vice President and also the President. Karibu sana Daktari.
So welcome everybody to today's session. It is very exciting to be where we are right now. So as Dr. Mbao said, supply chain has been an important part and parcel of PSK. So having this session where we talk about the supply chain is a very important part of it. Now, supply chain starts from where you talk about from the beginning, the inception of the idea, to when the patient is having the medication, taking it in, and also clearing it out of the system. So the whole thing, how do we make sure that the supply chain makes sense? So then we have decided to look at these various sections of this to make sure that some sections are not left untouched. For example, financing. When we talk about financing of the supply chain, a lot of times people will talk about funding of pharmacies and the wholesalers and other things. The question is, how about the patients who can't afford the medications? Can we come up with solutions that are going to help them be able to get their medications when they need them? Are there things that we can do out there to help patients, help hospitals that are not able to fund prescriptions for all the people who come in? Funding of prescriptions for patients will encourage compliance, and compliance will, all the things that come down, slow disease progression, reduce the chances of using healthcare, among other things. So that's about the funding and financing. We need to look at it holistically. Utilize, like things like track and trace. Track and trace, how do we know what medications we are using actually make sense, they come from the right place, who did, has it been handled by licensed and trained professionals all through the system? If not, why not? How can we make sure that happens? So that's another way of looking at supply chain. How do we track and trace from the inception all the way to where the patient is getting it? How do we make sure that that is a tight system where things don't leak in? We've had a lot of issues of counterfeits and other things. How do we make sure that system, that pipeline makes sense? Come to utilization and utilization of data. Data is a big part. Data guides you. Data gives you ideas on what to do. Data shows you where you're doing well, when you're not doing well. Data will show you when to buy, when not to buy. Data will tell you how much to keep. You make many decisions. So how do we utilize data to make sure that the supply chain is optimum? How do we optimize our supply chain using data? And that could also be used, that data can be used for funding. You could use that data to show how much you expect to get, your projections, and that can be a good, that's something that the bank would be happy to look at. Last but not least, the four things that not for this particular conference is about the pharmaceutical care solutions for UHC. So how effective the stuff that we get, the HPT that is supplied to us, how do we make sure we get the most effective, the most efficient, and the safest products to the patient? And how do we make sure it gets to the patients the way it should be? Things like the cold chain, things like making sure that there's no counterfeits that come in between, which is also a part of the track and trace. And all those things, because if we as pharmacists, I'm sure most of us here are pharmacists, pharmaceutical care, making sure the patient gets better, making sure we get positive patient outcome is what will lead us forward. And that is where we make our impact. We have gone to school, we have learned, we have been educated on how to ensure the patient is safe, how to ensure the patient gets the best, how to optimize their therapies. So this section, the wing of the pharmaceutical care, is a wing to say, how do we ensure that we actually, the pharmaceutical care we give to our patients through the supply chain of what we got is actually the safest, the most cost-effective, and the most effective in terms of making patient better. So today we have an opportunity to do something totally different, totally out of the box. And the thing we're doing out of the box is we are going to be dividing ourselves. A lot of times you go for conferences, and the conferences is where you sit down and listen to somebody giving you ideas on what they think should work, what should be done, which a lot of times are very good ideas and gives you the wisdom and what they did. The question is, how many people take that to go and use it when they leave the conference? And the other question is, how useful, how able are you, how easy is it to take it from an idea you heard to something that is actually helping your patients? So as a result, today, we will divide ourselves into 4 teams. So there's going to be team green, team blue, team red, and team yellow. Now, what will the teams be doing? They'll be doing something totally different. Each of them will take a part of the 4 things I mentioned. So, for example, team green will do funding and financing. And please, 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 if you don't think the idea is ridiculous, you're not far enough. You're not innovative enough. You should have the ideas that we put here should have a 50% chance of flying. It has to be absolutely ambitious. Make it as ambitious as possible. Let's push this. Let's push this to the edge. Here's why it's important to push it to the edge. Our president, Dr. Mushagu, put in something today about job postings that have been put up for executive of KEMSA and a few other things. We as pharmacists have been moving away from where we can play. What I mean by that is we don't feature as prominently as our knowledge allows us to in patient care. And patient care includes from getting the product to where the patient is well. So the question is, how do we get back there? How do we get to be on the table? How do we get to share the knowledge we have with the public and with all the patients that we see, plus also with our colleagues who are the clinicians? The way to move forward from where we are to where we want to be is by working, showing the value that we bring, because that is not very clear to many. The way to show the value is to get creative, to get ambitious, and to share what we can do. So these different groups, these different teams, they are going to go, you're going to go out. If it's funding, like I said, nobody has talked about, when you hear financing and funding, nobody talks about the patient. Is there a model out there? Can we come up with a model, something close to Fuliza without being Fuliza, that actually can, and sorry for Faricom, something like Fuliza that can actually fund the ability of a patient who needs antibiotic for 14 days and can't afford it? How can we make sure they get the full dose? And then here again, where so now that's number 1, that is the financing. Number 4, which was the pharmaceutical care. How do you make sure that patient got this 14-day prescription, understands well enough that I need to take this prescription for 14 days, and I can't stop after 2 days when I feel a little better? So that's pharmaceutical care. So how do we do that? How do we help those people who can't afford their medications? We are moving towards NCDs. NCDs, a lot of times, are managed by medications. If you can't afford your medications, we're really in bad shape. So we can't do that. So Team Green will be doing that. Green financing. That was very creative of me, or the team that we put together. So Team Green will do financing. That's interesting. And then Team Blue will do data. This is, how do you use data that you get? How do you know what to buy? How do you know what to keep? How do you know all those things, the expiration dates, the seasonal disease rotations? When do we have malaria? So when should we stop on malaria medications? When do we have the rains and then the malaria? I mean, how do we use data that we have to better manage our inventory, purchasing, procurement? And then also, how do we monitor? How do we know what do we put in our storage? How do we, all that data, how can we turn it into something interesting and cool for people to see and for people to use? Track and trace. This is a big one. And I would like, and this, on all these 3, I would like us to do 3 things. 1, and I'll get back to number 3. 1, get a policy solution, policy suggestion, legislative action. What is the legislation that we may need to do this to make this flies? And lastly, we need a business case so that, for example, the group that is doing funding and financing, if you come up with a product that you want to sell that can help with the patients, go for it. Let's have it. And after this, if we have a couple of people who want to go doing it, to go on and set up business with it, absolutely, we will support you on that. So I was by track and trace. How do we make sure that the track and trace? How do we make sure how do we make sure that what comes from the ingredients are the correct ingredients? Are the correct ingredients? How do we make sure that the ingredients that get into the system are the correct ones? How do we know they were the correct ones? How do we know they're actually efficacious and they were well produced? I mean, all of that stuff. Then you have a tablet. Who received the tablets? Who's the distributor? So the distributor, who's the pharmacy that gives to the pharmacy, to the patient? Is the patient getting the right thing all through? How do we make sure we have a tight system where we don't have, lack of a better term, nefarious actors in it who come in to the system and then cause the system an unnecessary turmoil? How do we make sure that people who are not supposed to handle these medications don't handle them? So whoever is in this team red, it's red, baby. Let's do it. Let's make sure that we come up with ideas that make sense. Is it a policy change? Is it a legal, legislative change? Is it something that we have to do creatively? An example, could we come up with a database of all the people who are licensed in the chain, and each of them gets a special blockchain, whatever it is, to see so that everybody who touches it, it is uniquely them who touched it, and we can follow it and find out who touched it where, when. The last one, which is close to every pharmacist's heart, is the pharmaceutical care. Now, for years and years, if you ask your mom, ask your dad, ask your friends, what does a pharmacist do? A lot of times people will tell you they count by 5, because that's what they see. We are in those cubicles where all you see is a grill, and people hardly relate. And we are very diligent in what we do. We also have a responsibility to share the knowledge we have with our patients, to ensure the patients are getting better. The public needs to understand that in this head here, we've learned a lot about receptors, we've learned about adverse effects, we've learned a lot about interactions, food, drug, food, drug, drink, all these things we've learned them. We understand this stuff, and we understand it well enough to be able to share it to our patients when you're counseling them, to ensure they optimize their therapies. So in the question, in that regard, how do we make sure that whatever comes through the system, the HPTs that we get, how do we optimize the care with them? If there's any care that needs HPT, the therapies that we have, how do we make sure we optimize those therapies? What are some of those suggestions? Again, as I say, what are those suggestions that are policy suggestions? What are some of those things that are actually legal suggestions, as in legislation, something we have to legislate? For example, can we legislate that pharmacists can run their clinics? The clinics will be absolutely, you come in with a brown bag clinic, where you come in with your medications, or you've been diagnosed with cancer, and then you have to come up with your system. You come in and say, okay, here's my diagnosis from my doctor. What is the best course of action? What are those things that we can do to get me from where I am now to where I have a quality lifestyle? So the question is, how can we get, if that is the legislation you're looking for, somebody coming with a business case of how a clinic like that can actually survive and be able to give the care that's given. Patients should come, doctors should just call and say, hey, I've diagnosed a person, he is a woman, he's breastfeeding, he has this problem, kidneys are a little pushed. What are the medications we can give that will allow her to still breastfeed, still go to work, and not tax the kidneys? So those are some of those things, unique knowledge that we have that we can share with the public. And we can go a long way towards helping with the UHC, a long way towards helping with having a healthy public. These are things that we can do, and we know we can do them. We know we can do this. So the team, the yellow team, this is exactly what you need to do. What are those things that we can do? In the lens of the public health, the lens of the supply and financing. Do we need financing for such an option? Could we finance the care of that? How can we make pharmaceutical care an essential health benefit such that insurers are required to reimburse for it? Just ideas. Please go wild, do what you got to do. How do we reduce the cost to healthcare and to the economy of medication errors? In the US, studies that I've seen, the medication errors cost the US economy $20 to $40 billion a year. That means when you lose work, that is economic output loss. So if you put all those things together, we're talking about that much. If you extrapolate, Kenya would be 52 million, so the cost is about 60 to 130 dollars per capita. If you do 52 million, it comes to around 6.9 billion dollars, not shillings, dollars that we lose as a country to medication errors. Pharmaceutical care would fix this. Think of what you would do with $6.something billion in the economy. So now the next thing is, so we have 2 days to do this, and at the end of the 2 days, we will come together, and whatever we come up with, whatever the results from these particular teams, we will be sharing it with the MOH to make sure that to share and tell them we have ideas and we can improve and share the building of the UHC. Pharmacists, let's go on. It's time to roll, man. Let's move on. Let's revive the pharmacy profession. Let's get there. Let's get to the healthcare table, and let's contribute. And I'm sure we can do that. So thank you so much for listening to me.